Assalamu alaikum and welcome to today's class. Today, our topic is Duodenum of small intestine from B.D. Chaurasia's Human Anatomy, 8th edition, chapter 20, small and large intestines. So let's start. Duodenum. The term duodenum is a Latin corruption of the Greek word duodecadactylus, meaning 12 fingers long. The duodenum is the shortest, widest, and the most fixed part of the small intestine. It extends from the pylorus to duodenojejunal flexure. It is curved around the head of pancreas in form of letter C. The duodenum lies above the level of umbilicus, opposite first, second, and third lumbar vertebra. The length, parts, and peritoneal relations of duodenum. Duodenum is 25 cm long and is divided into the following four parts. First, a superior part 5 cm or 2 inches long. Second, or descending part 7.5 cm or 3 inches long. Third, or horizontal part 10 cm or 4 inches long. Fourth, or ascending part 2.5 cm or 1 inches long. The duodenum is mostly retroperitoneal and fixed, except at its two ends, where it is suspended by folds of peritoneum and is therefore mobile. Anteriorly, the duodenum is only partly covered with peritoneum. First part of the duodenum. The first part begins at the pylorus and passes backward, upward, and to the right to meet the second part at the superior duodenal flexure. Its relations are as follows. Peritoneal relation 1. The proximal 2.5 cm is movable. It is attached to the lesser omentum above and the greater omentum below. The distal 2.5 cm is fixed. It is retroperitoneal. It is covered with peritoneum only on its anterior aspect. Visceral relations of the first part of duodenum. Anteriorly, quadrate lobe of liver and gallbladder. Posteriorly, gastroduodenal artery, bile duct, and portal vein. Superiorly, epiploic foramen. Inferiorly, head and neck of the pancreas. Second part of duodenum. Course of the second part of duodenum. This part is about 7.5 cm long. It begins at the superior duodenal flexure, passes downward to reach the lower border of the third lumbar vertebra, where it curves toward the left at the inferior duodenal flexure to become continuous with the third part. Its relations are as follows. Peritoneal relations of the second part of duodenum. It is retroperitoneal and is fixed. Its anterior surface is covered with peritoneum except near the middle, where it is directly related to the colon. Visceral relations of the second part of duodenum. Anteriorly, right lobe of the liver. Second, transverse colon. Third, root of the transverse mesocolon. Fourth, small intestine. Posteriorly, 1. Anterior surface of the right kidney and near the medial border. 2. Right renal vessels. 3. Right edge of the inferior vena cava. 4. Right psoas major. Medially, 1. Head of the pancreas. 2. The bile duct. Laterally, right colic flexure. The interior of the second part of the duodenum shows the following special features. A. The major duodenal papilla is an elevation present posteromedially, 8 to 10 cm distal to the pylorus. The hepatopancreatic ampulla opens at the summit of the papilla. B. The major duodenal papilla is present 6 to 8 cm distal to the pylorus and presents the opening of the accessory pancreatic duct. C. Below major duodenal papilla, a longitudinal fold called plica longitudinalis is seen. Third part of the duodenum. Course of the third part of the duodenum. This part is about 10 cm long. It begins at the inferior duodenal flexure on the right side of the lower border of the third lumbar vertebra. It passes almost horizontally and slightly upward in front of the inferior vena cava and ends by joining the fourth part in front of the abdominal aorta. Its relations are as follows. Peritoneal relations of the third part of duodenum. It is retroperitoneal and fixed. Its anterior surface is covered with peritoneum except in the median plane, where it is crossed by the superior mesenteric vessels and by the root of the mesentery. Visceral relations of the third part of duodenum. Anteriorly 1. Superior mesenteric vessels 2. Root of mesentery. Posteriorly 1. Right ureter, right psoas major. 3. Right testicular or ovarian vessels 4. Inferior vena cava 5. Abdominal aorta with origin of inferior mesenteric artery. Superiorly, head of the pancreas with uncinate process, and inferiorly it is related to the coils of jejunum. Fourth part of the duodenum. Course of the fourth part of duodenum. This part is 2.5 cm long. It runs upward on or intermediately to the left of aorta up to the upper border of the second lumbar vertebra, where it turns forward to become continuous with the jejunum and the duodenojejunal flexure. Its relations are as follows. Peritoneal relations. It is mostly retroperitoneal and covered with peritoneum only anteriorly. The terminal part is suspended by the uppermost part of the mesentery and is mobile. Visceral relations of the fourth part of duodenum. Anteriorly 1. Transverse mesocolon 2. Transverse mesocolon 3. Lesser sac 4. Stomach. Posteriorly 1. Left sympathetic chain 2. Left renal artery 3. Left gonadal artery 4. Inferior mesenteric vein. To the right, attachment of the upper part of the root of the mesentery. To the left, 1. Left kidney and 2. Left ureter. Superiorly, body of the pancreas. Suspensory muscle of duodenum or ligament of Treitz. This is a fibromuscular band which suspends and supports the duodenojejunal flexure. It arises from the right crus of the diaphragm close to the right side of the esophagus, passes downward behind the pancreas, and is attached to the posterior surface of the duodenojejunal flexure and the third and fourth parts of the duodenum. It is made up of A. Striped muscle fibers in its upper part, B. Elastic fibers in its middle part, C. Smooth muscle fibers in its lower part. Normally, its contraction increases the angle of duodenojejunal flexure. Sometimes it is attached only to the flexure, and then its contraction may narrow the angle of the flexure, causing partial obstruction of the gut. Arterial supply. The duodenum develops partly from the foregut and partly from the midgut. The opening of the bile duct into the second part of the duodenum represents the junction of the foregut and the midgut. Up to the level of the opening, the duodenum is supplied by the superior pancreatico-duodenal artery and below it by the inferior pancreatico-duodenal artery. The first part of the duodenum receives additional supply from the right gastric artery, supraduodenal artery of Wilkie, which is usually a branch of the common hepatic artery, the retroduodenal branches of the gastroduodenal artery, some branches from the right gastroepiploic artery. Venous drainage of duodenum. The veins of the duodenum drains into the splenic, superior mesenteric and portal veins. Lymphatic drainage of duodenum. Most of the lymph vessels from the duodenum end in the pancreatico-duodenal nodes present along the inside of the curve of the duodenum. For example, at the junction of the pancreas and the duodenum. From here, the lymph passes partly to the hepatic nodes and through them to the celiac nodes, and partly to the superior mesenteric nodes, and ultimately via intestinal lymph trunk into the cisterna chyli. Some vessels from the first part of the duodenum drain into the pyloric nodes and through them to the hepatic nodes. All the lymph reaching the hepatic nodes drain into the celiac nodes. Nerve supply. Sympathetic nerves from thoracic 9th and 10th spinal segment and parasympathetic nerves from the vagus pass through the celiac plexus and reach the duodenum along its arteries. Histology of duodenum. Mucous membrane shows evaginations in form of villi and invaginations to form crypts of liver cone. Lining of villi is of columnar cells with microvilli. Muscularis mucosa comprises two layers. Submucosa is full of mucus-secreting Brunner's gland. The muscularis externa comprises outer longitudinal and inner circular layer of muscle fibers. Outermost layer is mostly connective tissue. Now, the clinical anatomy related to duodenum. In the skiagram taken after taking a barium meal, the first part of the duodenum is seen as a triangular shadow called the duodenal gap. The first part of the duodenum is one of the commonest site of pancreatic ulcer, possibly because of direct exposure of this part to the acidic contents reaching it from the stomach. The patient is usually an overbusy young person with a tense temperament. The ulcer pain located at the right half of the epigastrium is relieved by meals and reappears on an empty stomach. The first part of duodenum is overlapped by the liver and gallbladder, either of which may become adherent to or even ulcerated by a duodenal ulcer. Other clinically important relations of the duodenum are the right kidney and the transverse colon. Duodenal diverticula are fairly frequent. They are seen along its concave border, generally at points where arteries enter the duodenal wall. Congenital stenosis and obstruction of the second part of the duodenum may occur at the site of the opening of the bile duct. Other causes of obstruction are an annular pancreas, B. Pressure by superior mesenteric artery on the third part of the duodenum, C. Contraction of the suspensory muscle of the duodenum. Duodenal carcinoma.